going to check the oxygen bottle. Now I know this is oxygen because it is in a white bottle. There's also sometimes black bottles, and they will both have a black cap. They also have a tag on which will state whether they're in use, empty or full. I'm now going to place the regulator on the oxygen bottle, firstly checking the Botox seal. I'll place this on here and make sure the pins are all lined up and screw it on. I'll now turn on the oxygen and I can see that it is half full, which means there's a sufficient amount of oxygen in there. I'll now check the flow rate by turning this dial, and that sounds good. I'm now going to attach this high concentration oxygen mask to here. This mask here is used for patients that are severely hypoxic, as it delivers at least 90% oxygen. I'm now going to turn the flow rate on to 10 litres per minute. If this bag here is not filling, or if it is deflating when the patient breathes, I will turn it up a flow rate. I am now going to take off the bag and turn the oxygen off, and then bleed out the remaining oxygen. I'm now going to test the LSU suction unit to ensure it's functioning properly. Firstly, I'll look at the piping and attachments to make sure they're all good. I will then hold down the test button and turn it on. I'll then occlude the pipe and wait for it to turn off. That is how I know it is good to go. I can also tell that there is sufficient battery. I will now test the rigid catheter by turning it on again and closing off the hole, and yes, it's good to go. When inserting in a patient's airway, go no further than is visible, and once in the airway, close off the hole and go out in circular motions. Do not use this for more than 10 seconds at a time, and also do not use this in a moving vehicle as you may damage the patient. I'm just going to check the first response kit. So in this top pocket here we have the adult and pediatric blood pressure cuffs, we have the glucose kit, we have the temperature, we have the stethoscope, the pupil torch and the shears. This pocket here is a miscellaneous pocket. In this back pocket here we have the IV and oral glucose and the glucagon. This pocket here, there's some emesis bags, lanyards and ethyl chloride spray. Over here is the trauma pocket. So we have some tourniquets, tape, crepe bandage, triangular bandage, saline, shears, gauze and different size swabs. So into the main compartment now. Up the top here we have the medications. So we have the Panadol, ibuprofen, methoxyflurane, and the antihistamine. And we're also going to check the expiry when I'm looking at those. This pocket here is for airways, so we have all the different sized OPAs and the NPAs, so just check all that. We also have the laryngoscope, the forceps, and there's also some lubricant and a biohazard bag in there. This pocket here is for medications given by the nebulizers, so we have adrenaline, butamol, and ibuprofen. Also check the expiry on these. This pocket here, there's the nebulizer, the acute mask, the nasal prongs, and the oxygen tubing. Now in the centre pocket we have the paediatric and adult bag valve masks. Inside there's a filter, the PEEP device tubing, reservoir bag, and while doing this, just want to take a quick look to make sure all the equipment's clean and in working order. Now loosely around here we've got towel, we've got an LMA kit, IV kit, sharps container, and cardboard splint. Now I'm going to complete our pre-shift check of the LifePak 12. So first of all, I'm going to turn this around and check the charge on the battery. Let's push these buttons here, and both of them are on low, and so I would replace both of these batteries. I'm now going to turn on the machine and do a user test. So go into manual mode, then I'll go into options, down to user test, and that will work itself out. Now while it's doing that, I'll just check to make sure that all the gear in the machine is present. So in this pocket here, there should be a 3-lead ECG, and that is here. Just the cording, make sure that battery all good. There's also SpO2, and this also appears to be fine, and there's also an ETCO2, which looks good. Now I'll just check the paper while I'm here. Replace battery. And yep, that's good. Now back here in this back pocket there should be a blood pressure cuff, which is cording appears to be good, and there's also other size blood pressure cuffs. There's also spare printing paper. Now in this pocket over here there is the cord which you attach the defibs to. Replace battery. So that is here, and usually this would be attached to this here, which is what the defib pads attach to. However, it's not today. There's also the test load, which I will use soon to test the charge on the machine. And in this pocket there is also medications such as GTN and aspirin. Just check the expiry on these. And there's also a razor. Put that back in there. And now my user test should be completed. Replace battery. So that says user test passed, so the machine is in working order. I'm now going to check the test, attach the test load and test the charge. First of all, I'm just going to select my energy level by pushing this button. Replace battery. And for the purpose of this video, I'm just going to turn it down really low so that it charges nice and quick. Attach that there. Press charge. Press shock. And energy delivered. Battery. Now at any stage throughout this, while it's charging, to cancel, you just simply push this button here. And now, at any stage throughout this process while working on this machine, to turn it back to AED mode, you simply push Replace analyze. Battery. Connect electrode. There. However, I want to go back to night mode. So I'm now going to attach the ECG to myself to show how that works. Replace battery. So bring this over here, and now the black and the white cord go on the upper chest. So the white one goes on the right side, high up on the chest. However, do not place it on a bony province. Now for the purpose of this video, I've already attached the sticky pads to myself. And then the left one goes up here. Usually there is sticky pads already attached, or in the case if they're not, they're usually stored in the back pocket. Now the green one goes on the bottom left side of the abdomen. Replace battery. On the left side. Go into there. And there you go, so I had to pick it up. Now you can change the view and show different portions of the heart. And to do this, replace battery. Lead, and then you just go down and select. So go into 1, 2, and 3 and see all different 3 views. And then I'll just change that back into 2. You can also adjust the size by pushing size. This means if you need a more in-depth look at what's going on, you can have a bit of a closer look. Another feature which is handy to use is turning on the volume of the heart rate. So you can do that by clicking onto the volume and then turning it up. This means you can get battery. you can have an idea of what the heart rate's doing without having to constantly watch the heart rate. We've been called to a 65-year-old male who was complaining of chest pains before collapsing. We are equipped in PPE again. Tom is my offsider today, and so I'm going to check to see if the patient is breathing. If they're not, can you please commence CPR? On arrival at the scene, I'm going to scan for any hazards and identify an exit route. Hello, sir, can you hear me? My name is Amelia, I'm here to help you. There's no verbal response. Now checking for a pain response. There's no pain response. Now performing a head, chin, tilt lift and checking the airways. It appears as if the patient is a GCS of 3. I'm now listening and feeling for breathing. The patient is not breathing. Can you please start CPR? Calling for backup, AUT to comms, we have an R50. I'm now going to put the defib pads on while working around Tom, as I want to minimise time on the chest.
Analyzing heart rhythm. Do not touch the patient.
Please top off the patient.
Shock advised.
Please start CPR
Charging.
again. The machine
Stay
is
clear
charging,
of patient.
so it's okay for him to continue CPR. We're trying to
Deliver
minimise time
shock
off the chest.
now.
Off the
Press
chest,
the orange
everybody
button
clear.
now.
Charging.
Shock delivered.
Let's start CPR again.
Start CPR.
I'm now going to maximise the patient's airways by placing them in the sniffers position. I'm then going to insert an OPA, measuring it from the end of the mouth to the mandible. When inserting it, I'm going to insert it backwards, rotate it 180 degrees, scooping the tongue out to the side. If the patient's gag reflex is initiated, I will use another option like an OPA. I'm now going to place a bag valve mask on my patient's mouth. This allows me to ventilate them for every 30 compressions. I will deliver 2 ventilations. I will be attaching this to 100% oxygen at a flow rate of 15 litres per minute. Now filling on. Can you please start counting me down from 25? When
25,
holding this,
26, 27, 28, 29, 30.
when holding the mask on the face, I'm holding it in a CE grip and ensuring that it is fully sealed. And when I deliver the 2 ventilations, I'm watching the chest to make sure that it is inflating. If not, it indicates that I'm not correctly holding the mask on.
30.
Tom's CPR appears to be good. He has full recoil, appropriate positioning in the centre of the chest, and it is a sufficient speed. After the next round on the defib,
25, 26, 27, 28, 29, 30.
we will swap positions and I will undertake CPR for another 2 minutes, and then we will swap back.
Stop CPR. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. No shock advised. Pause. If needed, start CPR.
Can you please continue counting down from 25?
25, 26, 27, 28, 29, 30.
The chest is inflating, so it indicates that Tom is correctly holding on the mask. While doing CPR, I will also ask any bystanders about any information of what happened during this incident.
25, 26, 27, 28, 29, 30.
I will also ask them about the patient's medical history and if they're taking any medications.
25, 26, 27, 28, 29, 30.
We will continue doing CPR until either backup arrives, the patient's condition changes, or we can no longer continue because of fatigue.
Twenty-five, 26, 27, 28, 29, 30.
I'm ensuring that while doing CPR, I'm fully recoiling, and I'm also not going too fast or slow.
25, 26, 27, 28, 29, 30.
Stop CPR.
Swap positions.
Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. No shock advised.
I'm now going to show you how to insert an NPA. NPAs are a good alternative to an OPA. They come in 3 different sizes. So when measuring, go from the nostril down to the mandible. This appears to be a good size. I've already lubricated it. When inserting, place perpendicularly to the patient and insert down. If it is resisting, give it a small twist. But do not use an NPA on patients with facial trauma. I am now going to demonstrate how to correctly ventilate a patient during CPR. So firstly, the bag valve mask is attached to 100% oxygen at a flow rate of 10 to 15 litres per minute. Now when holding the mask on to the patient, I'm holding it in a C grip very tightly to ensure there is full seal. Now I will deliver 2 ventilations for every 30 chest compressions. When doing so, I will compress the bag 1/3 of depth and I will watch the chest for chest inflation. Some contraindications of this are barotrauma and gastric inflation. While doing this, I'm also going to keep an eye on my reservoir bag to make sure that it's filling so that I know my equipment is working correctly.